As humans, we contend with various forms of diseases, but through ingenuity and scientific advancements, we are able to overcome them. Mpox is one of such occurrences, and efforts are already underway to tackle it through cooperation amongst nations. Welcome to Hude Hour, the flagship program of the Hude Network, where we analyze and discuss contemporary issues within the humanitarian and development space. I am your host, as always, Amadine Ogbewe.
And I am Joan Eze. You're welcome to the program. Mpox has had a resurgence in recent times, causing a global alert as the world prepares to save lives and prevent casualties.
Today, we're diving deep into the complexities of Mpox, exploring its origins, transmission, and impact on affected communities. We'll also discuss the latest research and public health strategies aimed at controlling its spread. We'll take stories from around the globe to highlight global and regional conditions as we speak. And here's a look at our headlines for the day. WHO Director General declares Mpox outbreak a public health emergency of international concern. In other stories, African CDC, WHO launch joint plan to tackle outbreak. And finally, first Mpox vaccines delivered in Nigeria outside clinical trials. Well, that's our headlines that we'll be taking a look at. But we'll go on a quick break now. When we return, we'll delve further into the background of Mpox and the state of things at the moment. Stay with us. Mpox is a viral illness caused by the monkeypox virus, primarily spreading between people through close contact. It can also spread from contaminated surfaces and in areas where the virus is present in wild animals, from infected animals to people. The monkeypox virus was first discovered in Denmark in 1958, with the first human case reported in the DRC in 1970, following the eradication of smallpox in 1980. Mpox cases increased in Africa, with notable outbreaks in the US in 2003 and ongoing cases in the DRC since 2005. Mpox reemerged in Nigeria in 2017. A major global outbreak began in May 2022, affecting Europe, the Americas, and other regions. By mid-2024, over 120 countries have reported more than 100,000 confirmed cases and over 220 deaths.
According to World Health Organization (WHO), Mpox symptoms typically begin 1 to 21 days after exposure and last 2 to 4 weeks, though they may persist longer in individuals with weakened immune systems. Now, common symptoms include rash, fever, sore throat, headache, muscle aches, back pain, low energy, and swollen lymph nodes. The rash often starts on the face and spreads to other body parts, including palms, soles, and genitals. It begins at flat sores, develops into liquid-filled blisters, and eventually crossed over. Some people may have only a few lesions, while others have many. The treatment of Mpox focuses on managing the rash, alleviating pain, and preventing complications. Early supportive care is crucial for symptom management and avoiding further issues.
Indeed, vaccination is key for preventing Mpox, especially for high-risk groups, which include health and care workers, close contacts of infected individuals, including children, people with multiple sex partners, and others who have clients. We'll go on a break, and when we return, we'll take a look at some examples from across the world on the status of Mpox so far. Stay with us. Straight into our first news item of the day, WHO Director General Dr. Tedros Adhanom Ghebreyesus has declared the recent Mpox surge in the Democratic Republic of Congo and other African countries a public health emergency of international concern. This urgent action, advised by an expert committee, reflects the rapid spread of a new Mpox strain in the DRC and neighboring nations. Dr. Tedros stated, he stressed the need for global action to address these outbreaks and save lives. WHO's Africa Regional Director, Dr. Matshidiso Moeti, highlighted ongoing efforts and plans to increase international support. This marks the second PHEIC for Mpox in 2 years. There have been over 15,600 cases and 537 deaths this year as we speak, with a new strain spreading mainly through sexual contact. Clade 1B cases have been confirmed in Burundi, Kenya, Rwanda, and Uganda. The WHO is working to ensure vaccine access and has released $1.45 million from its emergency fund. An additional $15 million is needed, and the WHO is seeking donor support. Well, you have it there. The WHO is up and running. When it comes to health issues, you can't count them out. And it says they're seeking donor support, and I think that's really important to know that, well, whatever the case may be, no matter how global or huge you think the WHO is, they can't do everything alone, and it's a concerted effort, like we said at the start of the program. So it's good to see, the efforts being made, and the fact that, the PHEIC, the Public Health Emergency of International Concern, is the highest risk alert that the WHO has, which means that it's something to be taken very seriously. And we look to see what that sends, the message it sends to people, so that they are aware that this is something that we take seriously. All the experts, all those who are concerned with this issue, they've all come together and said, you know what, this is a big issue. It's not something to be swept under the rug. So it's good to see more responses and see how serious others are also taking it.
Yeah, I totally agree with you, Ahmadine. The fact that the WHO has really declared this as a PHEIC is very, very crucial. That's to say that the world will be affected, and for the fact that they are already seeking for assistance and they've already deposited income or money rather for these vaccines to go around. And of course, sensitization has been raised, and they are raising more sensitization, education, and vaccination for the Mpox. Because if actions are not taken rapidly, it would really keep moving around the world and keep escalating.
Yeah.
Well, we look forward to seeing more of countries investing in this Mpox vaccines and reaching out to other countries. All right, let's move straight up to our next news item. The African CDC and WHO have launched a joint plan to tackle the Mpox outbreak in Africa, aiming to curb the virus and save lives. The 6-month plan from September 2024 to February 2025 has a budget of nearly $600 million. It allocates 55% for Mpox response in 14 affected countries and readiness in 15 others, with the remaining 45% for operational and technical support. We can see the plan adopts a community-centered, multi-sectoral approach tailored to each country's situation. It focuses on enhancing surveillance, laboratory testing, community engagement, and ensuring critical resources while building strong health systems. While countries are categorized based on their Mpox status. First, we have countries with sustained transmission. We have countries with sporadic cases or endemic reservoirs. And of course, we have countries needing enhanced readiness due to proximity to affected areas. And above all, we have all other countries. The plan outlines priority actions for each category, emphasizing improved surveillance, case management, infection control, vaccination, risk communication, and research. Well, we have seen it, even though we're already coming down to Africa, where we belong, right? We still belong to the world, actually.
Yeah,
so the African CDC, that's the Center for Disease Control, has thought it very important with WHO. They've come to a joint collaboration to say that, okay, let's work towards curbing this Mpox. And with what we've read so far, the whole risk communication, which is very important, at least if there's any information coming from a particular region, they should be able to communicate that to Africa CDC and of course to WHO. And of course, with that swift communication, they will be able to reach out to those regions and other regions that are affected and also save all other people that need the vaccine.
Yeah, indeed. There are high risk groups and others that we've heard about. But I think the other thing that concerns me or that I think about in times like this is how humans react when emergencies emerge, for lack of a better word. So people can panic sometimes. People can want to do some things that are funny.
Yeah.
There's the way people go into their shells or go to the things they know to work. So that's why contact tracing, surveillance, risk assessment, and all of
communication, and
that
research,
is
yeah.
important. So, and I wonder how that's really going to get to the people, because at the end of the day, it's not just health professionals who are getting sick, or if they are getting sick at all. It's the public, it's the masses. So we look forward to seeing that collaboration. It's a good one from the Africa Citizen, just because um, the WHO named it a public health emergency of international concern,
Of course.
but the Africa CDC also did the same for a continental concern, so to speak. So it's good to see that collaboration and to see how they are able to quell the people's, will I say, panic, if there's any, and all of that. So let them know things are in control, things are working well. And also, if you see something, say something, report on all of that. That's how we'll round up this area of the program. We'll go on a quick break, and when we return, we'll bring you more news items. Stay with us, we'll be right back. Welcome back. Now, for our last news item of the day, Nigeria received 10,000 doses of the Mpox vaccine, becoming the first African country to get this aid. The vaccine, Genius MVA, donated by the US, was distributed to 5,000 high-risk individuals in 5 states, with the most cases including close contacts and healthcare workers. Nigeria's Minister of Health, Honorable Mohammed Ali Pate, welcomed the vaccine and called for increased global support. The vaccine had been approved for emergency use by Nigeria's health authorities. WHO's Regional Director for Africa, Dr. Matshidiso Moeti, praised the US donation as a sign of international solidarity and emphasized the need for more global assistance. The WHO worked to improve vaccine access in Africa and collaborated with partners like Gavi and UNICEF. Nigeria enhanced its outbreak response with WHO support, focusing on surveillance, contact tracing, and monitoring at borders. By August 10, 2024, Nigeria had reported 786 suspected Mpox cases and 39 confirmed cases with no deaths. That was at August. Well, you can see there, just to chip in, it's good to have relationships and collaborations all the time. Speaking about Gavi and all these international bodies, we know that the current Minister of Health and Social Welfare was actually a big part of that scene and those bodies before he returned to the country to will I say, take the clarion call. So it's good to have these collaborations. So you see Dr. Moeti there praising the US because you mentioned before where Africa, but Africa is one of the continents. I want to say one of the more important continents, but there's no continent that's not important. And that's the whole point of it. So we all have to look out for ourselves in any way possible. So these vaccines, and I like how not just to Nigeria now, generally we seem to be getting some inkling or some, will I call it direction from the WHO that these vaccines are for high-risk groups, which we mentioned earlier. So perhaps when we talk to our experts later on, we'll get to know more why these high-risk groups are the ones who are more in need of it at the moment and why there's not, at the moment, a more widespread approach to giving it to the whole public. But it's good to see the collaboration, like I said.
Yes, I agree with you in the sense of collaboration. And when it's just like you partnering with people outside, not within your geographical location. Because the essence of this WHO, United Nations, UNICEF, and other international organizations that we have is for people to come together, countries to come together in time of trouble, in time of need. You can tell your brother country that, okay, I need this, I need that. So well done to WHO actually for the fact that they've supplied 10,000 vaccines to Nigeria, and of course to Mohammed Ali Pate that has presented the country at the forefront to at least receive those vaccines to send it to people
indeed.
that are at
I just
high
want to
risk.
cut in there when you spoke about coming together and all of that. Is at this moment that as a people, I think we've tried, but it's a funny statement to make because I don't think there's no other sentient species like humans. So we don't know how well or how badly we could be doing. But still, it's important to know that, when these things come about, it's time for us to, come together. And, when they say people have interests, the Mpox, is something, any disease actually, is something that is going to affect, a whole host of people. If it doesn't affect, it's going to affect someone, or thereabouts. And at the long run, it's all, affecting the human race. And again, why I think is an interesting thing to look at is when we face these things, we've heard of, viruses and other things, mutating. It's almost like they're also smart and trying to cope. But we'll hear more about that later. But we appreciate that in times like this, humanity realizes that we're all together in this.
Of course.
There's no one else. No
one should be left behind.
As we speak, there's no knowledge of any alien species somewhere who's going to come and save us. So we're here for ourselves, and the collaboration continues, and we hope that it's something that builds. And also, I think lessons have been learned and are being learned. When the coronavirus came, we believed, well, it's in the next 2 or 3 days they will announce that it's not a big deal and everybody will move on with their lives. And it happened almost like a movie when we started seeing global lockdown and there is, brand new concepts like the social distancing and all of that. So I think it's important that whatever the case may be, all of us, the people, all stakeholders involved, realize that it's best to be on high alert for something that might not be an issue than to, say, well, let's just see how it goes and then it blows out of proportion into something that maybe you can't control anymore. So again, we'll hope to see more of that, more collaborations from the WHO, CDC, the countries, and all of that. And also, when some regions are more affected than others, it's good to see the other ones coming in to ensure that everything is on point. Because, like we've talked about, the borders have to be protected so that it doesn't go any further. So that being said, that's how we come to the end of our news items segment. We'll go on a quick break. When we return, we'll be joined by a guest in the house, a medical physiologist, Grace Okwa, to do justice to the matter at hand today, which is Mpox outbreak and the ways we're hoping to tackle it and fight it as a race, as a people, as a continent, and globally. Stay with us. We'll be back shortly. Every day, amazing stories of hope and tenacity unfold across the globe. On Hude Hour, we dive into these inspiring tales and discuss the vital work being done in the humanitarian and development space. Humanity has never faced a shortage of challenges, yet we rise stronger through teamwork and determination. Though these remedies are often underreported, on Hude Hour, we advocate sustainable solutions. We bring you the latest and most impactful news on how lives are being changed. We engage with young change makers and experts who provide valuable insights into relief efforts and the challenges faced by local communities through a global perspective. Join us every Wednesday by 8 a.m. on Hude Network's YouTube channel as we embark on this journey of positive change. Welcome back. This is still Hude Hour on Hude Network. We're still discussing the issue of the Mpox outbreak and the efforts being made to curtail it and control it as we speak. We've been joined now by an expert, a guest in the house here, a medical physiologist, Grace Okwa, to do justice to the issue. Welcome to the program.
Thank you.
It's good to have you.
Thank you.
All right, so just to get an overview so everyone can follow along, there have been Mpox outbreaks before. What's different this time around, and what should people know about talking about the public, what to expect, things to look out for?
Okay, just like Mpox virus, it was previously known as monkeypox virus because the first case was actually discovered in a monkey laboratory, and that's why it was named monkeypox.
A monkey laboratory?
Yes.
Oh, wow. Okay.
Yeah, like laboratory monkey used for research and all.
Okay.
Yeah, so and that's why it was named monkeypox. It's not necessarily from the reservoir for this virus is not in monkey, but it's just that we had the first case in the monkey. And yes, the reason why the public the whole spread it's different from the previous time. Now it's more like a public emergency. It's because we have when it comes to illness and viruses, we have epidemic areas. There's these areas that actually have this virus. It is maintained. Then we have non-epidemic areas. So over the years, we've had this virus in this epidemic region. And that's why it was not a public health concern. It was just maintained. But as from 2022 downward, we start having cases and non-epidemic areas. That's areas that this virus are not there, they are not maintained. And then there are no really cases of, travelers going into the country. That's places like Europe, North America. So it's a concern because whenever virus reaches those areas, it should be a concern. It means that it's going to spread around. And it's more, the reason why they're more concerned is because they're not seeing any track record of people entering into the areas with the virus or people who are, they're not really seeing people who are closely related to maybe animals or having that virus. And that's why it's a major concern for the public health and also for everyone. And then looking at the symptoms, and that's the signs and symptoms, it actually have virus that they're actually similar to smallpox. So most times when people have this, they think, this is smallpox, but they're quite different from it. So one of the signs you might actually see that's from monkeypox, actually it can be less severe in some humans than in others. It can produce a lot of complications and infections depending on the individual. And so one of the signs you look at for it's rashes. They're having to say rashes from the face down to every part of the body, the genitals areas, and then it starts forming blizzards. That's sore with watery fluid inside. Then you start having fever, headache, back pains, swollen lymph node. Then you have cases of even sore in the throat. That's sore throat, and then it's just similar. It's just the normal symptoms we actually have when we have other illness. That's why most times when you come to the hospital, they're not really, the way they are tested, it's not like the way other illness is tested. Because if you should follow that route, you might not really get the virus. So a specimen has to be collected from that cell and then go through process. So these are actually the signs and symptoms you get to see. Then because it has an incubation period. So a person can be exposed to it. But you won't know after, because the incubation period is from 5 to 21 days. So after those days, like a week or 2 weeks, that's when you start having those symptoms. And they don't really come rashes, fever. Some persons might not even have rashes. Some persons might not even have lymph nodes. Some persons might not even have fever. It might just be sore throat and headache. So that's how the symptoms and
So for that period, you might not know you have
You might not
it,
know you
So
have
it's
it.
just like different strokes for different folks.
but you can spread it.
You can spread it. You might have it and not developing symptoms, but you can still be spreading it because there are even people who are asymptomatic. That's people who does not show symptoms. They actually they're carriers, but they don't really show symptoms. They can actually be spreading it. Although for that one, we've not really had more cases, just one or two. So we can't really start saying, okay, it is possible to be transmitted.
Okay, thank you so much. Let's move to the international level. We have international organizations, that's the WHO, that is specialized in this area of, taking care of any outbreak all over the country and all over the world. So, what are those roles that you think WHO are taking or they are doing to, you know, prevent this whole Mpox virus?
Okay, there've been a lot of things ever since it became a global outbreak. The WHO has really put so much effort to contain those illness, and one of the things is creating awareness. Because that is just one of the things we have to do. People have to be aware because there are a lot of people who are not even aware of this virus. Because before that, it was just localized to Africans, so it was not really a concern. So people don't even know about it. I remember this morning I told them, "Do you know about monkeypox?" Like, no, I don't know. So I think one of the things they are doing is to create awareness, community awareness, especially in areas where they're vulnerable to this. And also creating isolation centers because these people have to be isolated. We have to, so that's one of the things they are doing, creating isolated centers in areas where this illness is predominant, and also early detection. Those are the things they are putting together because when you detect it early, it's very easy to start curbing it and start going about it. And then another thing is tracking the chains of transmission. I think that's one other thing they are trying to do, having to track places where these things are found. And I think there are a lot of research going on that's by WHO to understand the dynamic of this virus because we've not really gotten to understand what this virus is. Because it belongs to this family of virus. So there's just this similarity. So they're trying to understand the virus itself, the human-to-human transmission, because even the virus we can actually transmit this virus to even animals. So it's not like it can be transmitted from animals to human. It can be transmitted from humans to animals. So we need to understand the dynamic of this virus. I think that's what they've been doing, and I think with time we might come up with something good.
Okay, Amadi.
Okay,
sorry,
let me. Okay, go ahead. Let's go.
All right, so let's move down to the vaccination equity, right? From our news item, we saw that 10,000 vaccines were sent to Nigeria. So, and these 10,000 vaccines are for people that have the severe or they have been diagnosed or found with the Mpox virus. So, what happens to other people that, even though in quotes they don't have, but they need to be vaccinated to prevent them from this? So, where's what are those steps that are taken to make sure that there is equity in the vaccine spread?
Okay,
Distribution.
Okay, I think for the vaccine distribution, they've not been massive. They've not really declared a massive distribution of this because even the vaccine, it's not really Mpox. But we've discovered that the smallpox vaccine is actually 80%, like say, effective, for actually preventing
The Mpox.
and also rather than trying to spread the whole vaccine. So we're looking at the vulnerable people first of all. And that's how you deal with issue. Checking out, okay, these are the people who are vulnerable, the health workers, and it's not like those who are not, because even the vaccine are not really for those who are actually infected by themselves. So for those who are living in community that have this vaccine, who are likely to be affected, maybe in the nearest future or now. So that's why they're trying to see as much as possible where we can have it in a very base form where we're able to help those who are in vulnerable community and those who do not really have access to all this. And that's why it's just as if, okay, what are people doing? What? No, I think their approach is actually the best. We want to deal with the vulnerable community first, the health workers, and then before, I think maybe they'll start a massive vaccination. So.
All right. On the issue of awareness, before we maybe come back to vaccines, to take it more practical now, for someone watching us right now, what is it that they can do? What steps should they take? What precautions, just to avoid or to curb or reduce or control this issue as we speak? Because some people have their own idea of what they
Yeah,
feel will work for them,
work for
but
them.
is not, verified by experts. So if you can help us create that awareness.
Okay, for those who are not yet infected,
Mm.
one of the things you have to do is understand what the virus is and also understand the signs and symptoms. So even when it's not like you're saying, okay, this person have it. Well, even when you're seeing something that looks like, so understand, okay, there's rashes, there's headache, someone complaining of fever, headache, back pain, and you're seeing rashes and all over. So first of all, you watch out for the signs, like you're not infected yet, so you watch out for it. And also regular washing of hand is something we keep emphasizing, even before the COVID-19 came out and all. Because the thing is, one thing about this virus, although it is not really been said, but the CDC said it can stay on the surface for like 15 days. So it means that if an infected person touched this place, like after the next 15 days, if before the next 15 days, if someone come in contact with that surface, you can get infected. So regular washing of hands. You might not have the whole everyday washing of hands, but at least get your sanitizer, because this virus can be disinfected by alcohol, that's your sanitizer and swab. So regularly washing of hand. Always wash your hand after touching your surface, before touching the surface, whatever. Then avoid close contact because it's very infectious. It can be transmitted. And that's why this is really a public health concern. Just your respiratory droplet, as a cough or a catarrh from you, can get a person infected. So avoid living in a crowded place where there's no much ventilation and all. So those are the things we can actually put in place to contain or not to get infected by this virus.
Sorry, just still on awareness. We talked about animal to human transmission. So, what should people consider about that? And also, Mpox is not classified as a sexually transmitted disease, but the WHO says that this new clade is being transmitted more through sexual contact. So, what's that about, really?
Okay, it has not been declared, but we've had cases. I think over the years, the cases we even had from actually through sexual contact. The thing is, because this virus, because we actually said from the beginning that the rashes can be found in your genital, and so there is a connection going on, and so that is how the virus. So it's not really transmitted, but because there's a touch. Because even through contact and touch, there's a touch of body. So, and then you're having the stain of this virus within your genital region. So from that part, you can actually get.
So about the animal to human.
Yeah, about the animal, I think the only way for us to handle this is not to get closer to most. When you notice a rodent or whatever animal is sick, always separate, because that's the only way we can actually not get infected. Because I know that a lot of people go into the forest, go into bushes, but we still have to understand that there's a place for life. So the advice there is just to look of how to not get associated with most of those animals and all, and even we ourselves, because it's human to animal transmission. When we notice we have the sickness, we shouldn't get close to this.
Especially our pets.
Our pets at home, and also that is just the only way we can contain them.
Okay, I was thinking you were going to add we should reduce the way we eat meat.
Okay, yes. Even the thing is that you cannot tell a person as an African man to reduce, but the only thing we can advise is cook it. These days I've done thinking, okay, this is the fashion way, but cook it, like let it be cooked enough to feed, because we can't tell you to stop, because people, even during the COVID-19, there's the coronavirus and all. Ebola. So we can't tell people to stop eating this bushmeat. So the best thing is cook it, and we can also tell people to stop going into the bush, because these days people are looking for how to feed, and also they're always going to the bush. Whatever you're doing, wash your hand regularly. Always have your sanitizer close by. So whatever you touch, you are washing and all. So that's it. But the virus is not really deadly. It is not. So even without medications, you can get well from it after 2 to 4 weeks of the symptoms. You just stay in your house. You can just get hydrated. You're okay, and then you'll be fine after 2 to 2 weeks. The only people that it gets so deadly and highly infectious are those people with weakened immune. People
system.
already have some virus, HIV, and all that because their immunes are already weakened. So those are the people. Yeah, and again, for babies also, they also have weakened immune, even if they don't have virus. And so that's where, and pregnant mothers. So that's where we have severe cases, even though the virus itself is not as deadly as we had Ebola and others.
I know, John, you're about to come in now, but I just want to add something to the issue of bushmeat and eating and all of that. So I just want our viewers to know, if you're watching, there are also laws against that. So you shouldn't think that perhaps it's something that you can just do. So there are definitely ecological laws and trying to ensure that these species are not, hunted down or some and so on and so forth. But just to add that, you should probably check that out before you go out there and get small bushmeat for yourself.
Yes.
Go ahead,
Okay,
John.
yeah, so I don't know if Amadine has more questions, but this is just like in your perspective as an expert and a physiologist, what are those lessons to be learned or learned rather from the whole global? We've had a lot of viruses outbreak. We have from Ebola down to COVID-19 and now to Mpox. So for the past years, what are those things that we should learn and we should unlearn and we should prepare for? It's not that I'm wishing the world to have more viruses, but we should be prepared for more viruses to come. What's your advice on that?
Okay, one of the things I'll always advise is the preparedness for the public health. We shouldn't wait for illness to become global before we start creating awareness because Mpox has been there over time, but because it was just localized to African alone, so the public health was not really, there was not even emergency on it. But then it was there. So we shouldn't wait for it to become a global thing before we start preparing ourselves. So because we already know that with time it's real. I'm not praying for it, but to avoid future problems. So we should always, one of the advice I'll give to the WHO is to always prepare ourselves for this virus. For these things, we're not really, just like we say, it's not like we're asking for it, but we should always prepare for it, creating isolation centers. So it's not when it comes to start, trying to move around, trying to see how to go about it, create isolation centers. They should already be on ground. So even when we have this case, we know where to put them in and where not to put them. I think with these, we can actually help or even prevent most of this. And also research too. Always having to do research, making sure that, okay, even if they're going to be outbreak, at least we should already know what to do before it even comes. So research, again, is another thing I would want the WHO to also deal on. I think that's just...
All right. Is there anything you think developing nations can begin to do in their own space? When the coronavirus was, quote unquote, active, we saw some persons popping up and saying, I have the cure. I cooked up some herbs at my backyard and I think it will cure it. So, but there is still an iota of, I don't want to call it truth, but an idea there that we do have something. So I wonder, how do you think we can progress towards research? Is this something that developing countries can do on their own? Or should some of that funding that we keep seeing what's it called now, to control or treat, should they also be channeled towards, prevention and research?
Yeah, true. Because I think I really don't know. Because even when from Ebola downward, we had people who said they were cures, and or I can even down to even HIV. We've always had cures, but we're not really seeing this thing. So I can't really see why the developed countries, because I feel like those people really have all it takes. So I really don't know why they're not really going as far as getting those things, because I know they are there. Like, I've had interaction with people, so I know those things are there. So I really don't know if they see it more better than getting the funds for preventing and rather than finding the solution. Because the truth of the matter is, when the solution is there, there will not be funding and all. So I really don't know why they're not really pushing. Because for me, I would always want them to, rather than channeling the money to prevention, why don't we go on a deep, in-depth research and get solutions to this thing just to end it once and for all? So I can't really talk on that.
Okay, so finally, just your word on the issue of vaccine. It's one of the messages we try to pass here. What message would you have to people, perhaps those high-risk groups and others, about the safety of vaccines and why they should welcome it rather than, having skepticism and all of that?
Yeah. I think the vaccine is the smallpox vaccine. So I think a number of people had those vaccines even while growing up. So people should not be skeptical about it. It's not going to harm them. Just like the way COVID-19, people think the vaccine it's not going to harm them. It's just harmless. It's just a way for us to cure up this thing and prevent it so we don't get, because the thing is we are having the cases, even the transmission is still is as if other means of transmission we've not gotten to know. So people should take the vaccine if it comes, because there's not even a massive vaccination right now. So for those who already have access, the high-risk group, they should not shy away from this vaccine. It's not a way of the federal government trying to come take something. No, it's just a way of safety. So that's just the advice to the people.
Thank you so much, Grace.
so much.
It's been a pleasure. Thank you. All right, we just got some, enough sensitization there for free, I might say. So in any case, I hope you took note. We've been talking to Grace Okwa, a medical physiologist, and on the issue of Mpox outbreak, the things to note and what to watch out for, how to prevent and perhaps curb it. So we'll go on a quick break now, and we'll go next into our Verified Voices segment. So stay with us. We'll be right back. Every day, amazing stories of hope and tenacity unfold across the globe. On Hude Hour, we dive into these inspiring tales and discuss the vital work being done in the humanitarian and development space. Humanity has never faced a shortage of challenges, yet we rise stronger through teamwork and determination. Though these remedies are often underreported, on Hude Hour, we advocate sustainable solutions. We bring you the latest and most impactful news on how lives are being changed. We engage with young change makers and experts who provide valuable insights into relief efforts and the challenges faced by local communities through a global perspective. Join us every Wednesday by 8 a.m. on Hude Network's YouTube channel as we embark on this journey of positive change. Welcome back. We're still on the matter of Mpox right here on Hude Hour on the Hude Network. Let's take a look now at what the key players in the humanitarian and development space are saying about the outbreak. This is our Verified Voices segment. So let's take a look there at the first one. We have from the World Health Organization, the WHO and partners have established an access and allocation mechanism aimed to increase access to Mpox vaccines, treatments, and diagnostics for people at highest risk, and ensure that the limited supplies are used effectively and equitably. That's what the World Health Organization is saying there. You can take a look there. That's a very touching image there. That's a child with clear symptoms. Anyway, it's something that I think the WHO is making very clear here when it says equitably and effectively. So it goes to show that those vaccines have been provided for high risk group, those who are at highest need of it. It is not then an avenue to not be careful about how it's used, because even just a vial of that can help save a life, if not save a life, save more lives actually. Yeah. And a lot of discomfort, because though the mortality rate might not be so humongous, it still causes a disruption to people's lives. And so the WHO has also established the access and allocation mechanism to make these things easier, to ensure equitable distribution, and to ensure that those who really need it the most get it first before, the broader situation can be looked at. So it's a good one for them.
Yeah, I really agree with you. That's based on the allocation, the vaccine equity, and also reaching out to those people that are prone or that have been exposed or
Yeah.
diagnosed with the Mpox virus. It's a little bit scary seeing it on that child as displayed on the screen, and the way it is on the skin and all that. It's not really that nice, but I look forward to these people getting vaccinated
Yeah.
and getting healed as well. And of course, later we'll get, subsequently rather, we'll get people vaccinated from the mpox. All right, let's move quickly to the next um, verified voice. Okay, we have from WHO, that is the World Health Organization, has added the MVA BN vaccine to its pre-qualification list to help faster procurement of Mpox vaccines and to support communities in urgent need. As hashtag Mpox outbreaks continues, equitable access to vaccine is crucial to saving lives. Amadine, we are still saying the same thing. WHO is really pushing uh, forward for this spread, distribution of the Mpox vaccine because it is very crucial in their words, very important for people to get access to this vaccine. If not, the more, just like how other topics we'll be talking about, if we don't start now, people continue to get
At risk, yeah.
you understand?
Affected,
So
yeah.
get affected, that's the word. And it's not really good.
Yeah, and I also, look at the way different vaccines are being verified, so to speak, by
WHO.
WHO. There's really very little things, if not nothing, by the way, that's concerned to health, where you wouldn't want to check out the websites of the premier organization on health to confirm. So it also helps curb to some extent the issues of vaccine hesitancy, because some random body or person says, "Hey, there's this vaccine I heard about. Why don't you take a look at it?" You just have to go and check on the website and confirm that it's verified, it's approved, and it's supported by WHO and Gavi and other such bodies to ensure that there's vaccine confidence. People are more ready to take it. So let's take a look. Okay, go ahead.
I think before we move to the next one, speaking on that vaccine confidence and hesitancy, they are just two opposites of themselves. And people, this is where the power of sensitization comes in.
Indeed.
Because when information, the rightful information is not being given by the rightful source, people tend to spill things, to the public. You see somebody who just wake up one morning, wear suits, and come online and start saying, "I have the cure to whatever is going on," but it's not verified. You're not even a health practitioner or nothing like that. And most times, or sometimes, most of these health outlets, they are silent about it. So it makes people confused. So I think this is a clarion call for the health practitioners, the WHO, the UNICEF, everybody under the health sector to push out the information of Mpox, sensitization, education, and all that for people to know that this information is coming from the right
I really
sources.
heard you there, John. It's better to wake up, put on your suit, and direct people to WHO rather than
giving out the information
that you don't
by
know
yourself.
about. So
Of
that's what
course.
we're doing here. Anyway, so let's take a look at our next verified voice there. We have from the Global Fund. It says, just announced at the request of the government of the Democratic Republic of Congo, Global Fund is supporting the country with $9.5 million for its emergency Mpox response in 6 of the highest transmission provinces. The Global Fund, we know they are concerned with, the main issues. And Mpox might not originally have been part of their, their
Budget.
Yeah, but you have to roll with the times, as they say. What again always interests me in all of this is how there's the need for lack of wastage and effective usage. It says there in the highest transmission provinces. That is to say, even though we know that the DRC has been the hotbed for this and they've been the most badly affected, the Global Fund didn't just release funds and say, you know what, just use it in any way, and we always call and look forward to that kind of accountability
Yeah.
and effective usage. It's almost like, the way, growing up would hear about not wasting food and all of that. These things help because, like I said, just one person getting vaccinated might have helped protect a family. If a health worker who has to constantly be in
The field.
yes, in contact with
Online,
these
yeah.
things, if he's protected or she's protected, they are safer going home, knowing that I'm not, I have no chance of spreading it to anyone else.
And
Even
their
if
family is they are ready to receive you back home because
exactly,
they know they will not be
there's a
affected.
happiness there. So again, I think the message of effective use, no wastage, being very strategic and logical about this should continue to be on the front burner, and no one should think that, well, since these vaccines we didn't have to pay for it and we got it, we can do whatever we want with it, or these funds that are coming to help us with contact tracing, surveillance, and all of that, we can use it for other things. It must always promote equitable distribution and fair usage in any case of it.
You got the word right there, fair usage. And well, thank you to a very big thank you to Global Fund. They've always been there. This is something I talked about earlier in our discussion, where I said the whole brotherhood of nations coming together. That's the essence of all these international organizations that countries are meant to belong to, so that at the time of need, you have people to assist you, to run to your aid. So, well, thank you to Global Fund, and of course, they are also there to make sure that it's being distributed equally, and there is no wastage or misuse of the money. Okay, let's move to the next verified voice. Oh, we have a beautiful picture there with kids raising their hands up and the teacher in front of them. Okay, let's get to know what this is all about. We have Africa CDC. It's a question. Did you know children are at a higher risk of severe Mpox compared to adults? As a teacher, to be a champion, as a teacher, be a champion and raise awareness on the effective ways to help stop the spread of Mpox among your students. Okay, and this is just like the distribution, or will I say, the architectural work or the aesthetic work that we're seeing in the picture. We're seeing the teacher saying, I ensure that my students are aware of protective measures against Mpox. Okay, that's a very wonderful one from Africa CDC. It's already obvious. It's well explanatory. Personally, that teachers are at the front line. This is where education still comes in, sensitization still comes in. That teachers need to educate their pupils or their students. And from what Africa CDC is saying, that pupils or students are much likely, or children rather, are at the front line of getting this Mpox. Because imagine you running to school, you must surely hug your friend, you brush, and we even forgot to ask our guest if sweat. Well, obviously, I think sweat
contact,
can actually be a very huge factor of contracting that particular virus. So these are people that children are mostly prone to this Mpox virus, and teachers should be the champion of raising the gospel up. I call it the gospel, of telling people that this is what you should do, this is what you shouldn't do, because Mpox virus is real.
Indeed, and like Grace said, our medical physiologist, there are people who are at higher risk, those who are more vulnerable. So you can sort of extrapolate that children should also fall into that region, because they don't have as fully formed immune systems perhaps as adults. And it's very clear that from Africa CDC saying they are more, they are more, or they have more severe occurrences of this. And children being children, I recall back then, a child could go to school with a white shirt and come back, and the shirt is completely brown. There's no ounce of white
What
anymore.
happened to your shirt?
Or a child comes and they didn't come back with their shoes. So they can do all sorts of things. So it's important to educate them and let them know. And children are very easy to teach. Like they say, it's hard to teach old dogs new tricks. When you tell them this is what you should do, they take it home and they take it very seriously. And so that advocacy is for our teachers to try and do more in that regard and help our children be just a little bit more safe. Well, that's how we end the program today. We've been talking on Mpox here on Hude Hour on Hude Network, and I believe we've been able to show you the steps you can take, preventive steps in terms of controlling, see something, say something, isolate, drink water if you end up perhaps unfortunately to be one of those affected, and take care of yourself. We'll continue to do this, and we hope that you join us once again when we come back to you on Hude Hour on the Hude Network. Thanks so much for joining us today. See you next time. I am Amadine Ogbewe. Bye for now.
And I am Joan Eze. Thank you for joining us.